My name's Alex. I'll be your OT today. So do you know what OT is?
Overtime?
Not overtime, but overtime is pretty fun.
Man.
I am an occupational therapist, and what I do is I'm going to get you back to being as independent as possible on sort of the occupations or the meaningful roles in your life. Certain things happen, like you got a hip replacement, and it may hinder your ability to do some things. So it's my job to get you back on track and to be able to be living independently as possible. Okay?
Sounds good.
Already awesome. So you did get a right total hip arthroplasty, and they went in through the posterior side, which I think is a better route to go at it. And so I am here to help you stay safe and not to injure any of that that total hip arthroplasty, and to get back to doing your activities in a safe manner.
Mm-hmm.
So we want to get you to do these things without injuring the hip or re-injuring the hip. So what we have is what we have is a hip kit here. What I'm going to do is I'm going to go through this hip kit with you and explain to you how to use certain items. Okay, so you have certain precautions with your hip. So it is not recommended, and you should not bend at your hip or flex at your hip past 90 degrees. So that is no bending down to tie your shoes. That is no leaning forward. That is no awkward movements where like sticking your leg up over the other one. You also can't adduct your leg, and that means you can't cross your feet, anything of that manner. And that also has to do with putting your leg up like this. So no crossing your legs over like this. Also try to keep your feet, these are good right now, just try to keep them not twisting inward. We call it internal rotation. So we don't want you to internally rotate your feet. That's also going to put your hip at a sort of a vulnerable position. We don't want you to re-injure that and have to come back in for another surgery. So what these pieces of equipment do is going to help you stay in the right positions when moving around and doing the things you want to do. So I will give you an example of these. If I can see myself in this video here. Okay. So this is what we call a reacher. This is just simply used to reach things in your space that you may not be able to reach otherwise. And so we recommend that you just try to keep things, when you head back home, to keep things in the reach of the reacher. Nothing too high, you don't have to reach too far up, and nothing you don't have to reach too far low. Just enough to get to reach.
Okay.
I'm going to have you just reach for this teddy bear here so you can grab onto that. There you go. Yeah, so you can use that in certain situations, like if you were to be dressing, and you're in this position right here, and you did pick up your pants off the floor, you would use a reacher and you would pick up your pants, and it can help you in dressing, just grabbing things in general, grabbing your hip kit, just like that. We also have a long-handled shoehorn. So, like I said, there's no bending down or bending over to tie your shoes or put the shoes on. So this is going to help you, when you have your shoe almost on, to put it in the back here and slip your shoe on, and that way you're not breaking any hip precautions, okay? Alright, and this right here is a pretty handy tool. So when you're getting to move over onto the side of the bed, sometimes it can be tough to lift that other leg. And so what I'm going to have you do is sort of come forward on the bed for me. If you can. There you go. Alright. Yep, so this is your bed one. And so you're going to take this right here, you're going to hook it around your foot, around your leg if you can. Alright. And then I will help you out this time. And you are going to take that, and you're going to take your leg, and it's going to help you pick it up so you're not dragging it across, and bring it off the bed. There we go. Alright. Excellent. Alright, this is going to be a back sponge for when you're in the shower. Woo! It's going to help you get to the lower spots without having to bend down, be able to get your back and all your lower extremities. A lot of this stuff is just to help get the areas of your body that you would normally get while bending over. You don't want to break those precautions. Alright? This because this is something that we do every single day, or mostly every day, is put our socks on. So this is a sock aid. What you do is, we don't have any socks right away, so I'll just pretend there's a sock. Let's pretend there's a sock here. You would stick a sock on here, and you would just take it all the way up to the very top, so the end of the sock would be here, nothing sticking out. Take it all the way to the ropes, and you would set it down. I'll show you right here, this, and stick your foot through, and then pull the sock all the way up. Let's see if you can mimic that.
All right.
Sock comes on, all the way up. Beautiful. Nice. Yep. And your socks on. Woo. And last but not least here, because is like I never get this the way out. This is what we call a dressing stick. This has got several hooks and sort of different shapes on here that's going to grab some clothing, and it's going to help you either pull it up or help you position it on your body if you ever need to adjust. Again, it's just long handled enough to where you're not having to bend or break those precautions.
Okay.
So what I'm going to do is, my plan is to come back and sort of train you on some of these devices more thoroughly, and to hopefully get you back to living at home as safely and as effectively as possible. So I'll be back in a few days, and we'll start therapy then.
Love it.
All right. Good. So the recommendation is that you are non-weight bearing for right now. So what that means is we don't want any weight in this extremity whatsoever. So you can put weight on this one. This is what you're going to be your good side for now.
Okay.
But this one, if you would just put no weight on it, pretend like there's an egg and you're going to crush it under your foot, if you would put any pressure on that at all. And if something happens, it slips up, you put a little bit of pressure on it, that's probably not going to do a crazy amount of damage, but we're going to just try to protect this joint and your hip replacement and get it back to being fully strong and fully capable of bearing that weight. But for now, you're just going to be no weight bearing. Okay?
Okay.